So there's also a role for health beyond the health sector, and for health specialists and health advisors beyond the health sector, and that's really critical, and it requires the health sector to take on nutrition as an issue which it cares about and which it's going to advocate for across sectors, into new partners, talk to new people. And you could talk, for example, therefore in agriculture, you can talk in WASH, we could talk in social protection with cash transfers and those sorts of things. And these are the so-called nutrition sensitive interventions, where it's an intervention in another sector or with another partner in another part of government, which is likely to have an impact on nutrition. Now, the question is, of course, is how strong is that impact going to be, and how strong is the evidence going to be? And for some of those interventions, the evidence is not strong. And that's for a variety of reasons. If the studies haven't been done properly, the intervention is a long way away from the impact. The pathway impact is very long and complicated. So there's reasons why there's not good quality evidence. But there's also a rationale to think that these are interventions that need to happen. They will have many outcomes which may be directly into nutrition. They may support livelihoods. They may support hygiene and reduce bad health, diarrhea or other things in other ways. So they are going to have various different outcomes and various different pathways, but in theory they will all have impacts on nutrition. So what's needed for the health sector is, number one, to recognise that it has a role beyond its own sector. It has a role beyond the health sector. It has a role in advocating for the importance of public health and the importance of nutrition within other sectors. So it needs to recognise it has a responsibility to do that. It needs to use its power, the power of the health sector, to bridge into other sectors, and it can use nutrition as a very clear bridge. It can say, we firmly believe that an intervention in your sector will have benefits for nutrition and public health. It then needs to think about how to align the objectives of the other sector, whether it's agriculture or WASH or social protection, how to align those objectives with the objectives of the public of the health sector. So in agriculture, if you intervene in agriculture to improve agricultural production of a small scale farmer, smallholder farmer, what are the pathways to health? Well, they're complicated. They could be that the household will produce a lot of diverse foods, feed them to the children, and the child will grow better. It could be that the household will only produce one food item, one type of food item, but in a large quantity. Take that to the market and then sell the produce, and with the income it might buy nutrition for its child. But we don't know. And in fact, those choices about what people spend their money on are incredibly complicated and are mediated by multiple different external factors which nobody really has much control over. But what we're trying to do is we can provide education, advice and support, but there are clear pathways from, for example, an intervention in agriculture which may have a benefit for health, and we need to provide the enabling environment for that to happen. So that's the third step then, work to align the objectives. So we would align, an intervention in agriculture, you would align an objective that we want this agricultural intervention to benefit nutrition outcomes in children through this pathway. And then of course you need to monitor it. You need to take you need to be accountable for the delivery of it, or certainly accountable to measure the impacts. And those impacts can be positive, improve nutrition, but they could also be negative. So going back to agriculture, of course, if you support a woman to grow an increased number of crops in her field, that's going to take a lot more of her time. So does she have that time? What are the impacts on her and her energy requirements? And what are the impacts on her ability to look after her children, for example? So there are unintended consequences. And then, of course, finally, the health system has a real role in advocating at the very, very highest level, that many of these interventions, development type interventions, whether they be in supporting people through cash transfers or in WASH or whatever it is, they are likely to have an impact on health. And therefore that they need to be supported appropriately, and that the impacts on health and on nutrition should be measured and should be recognised. And I think that's a critical role for the health sector beyond its typical remit of supporting the health system. So we have in the nutrition and health agenda some very siloed sets of evidence. And those sets of evidence that we have typically relate to an intervention and outcome. So provision of vitamin A, mortality in children, or provision of folate in pregnancy and reduction in neural tube defects in infants. But what we don't really know are the sort of many of the bigger questions which cut across those silos, but also compare those silos. So the evidence on agriculture for nutrition, agricultural interventions for nutrition outcomes, is emerging. It's much larger than it was 5 years ago, but it's still relatively in its infancy and not enormously coherent or synthesized in any particular way. But what we don't know is whether or not an intervention in agriculture is more cost effective than an intervention in WASH. So the comparison of those two data sets, or those two interventions, and I don't think we'll ever know that from rigorous randomized controlled trials, because that's an enormous intervention to roll out, enormous expense, real questions about whether it's ethically appropriate to do that sort of thing. So what we need to know, so the real evidence gap is the lack of data. And there's a critical need to improve the quality of data collection across different sectors to ensure that we can and a critical gap in our ability to analyze those data in innovative ways which allow us to compare the likely impacts of different interventions. And I think that is a real need and a real academic need for us to be much more smart, much more innovative in the way we think about data collection and we think about data analysis, so that we can answer some of these really big questions. Is it better to build a road which will ensure that villages have access to markets, or is it better to put down water systems and sanitation systems in a village? We don't know the answer to that question, and there will never be a randomized controlled trial to answer that question. But we need to think about the data we would need to answer that question and the analysis method which will allow us to answer that robustly. There's a real need for data to be open and transparent. And certainly in agriculture and nutrition, there's a global initiative now called GODAN, the Global Open Data in Agriculture and Nutrition Initiative, which is absolutely striving to do that. It's trying to get people to release all of their agriculture data in all countries and their nutrition data, and then it's trying to stimulate clever, smart data analysts to come together and think about how to analyze those data in new and innovative ways. So there's a real need for there to be much more openness, and that can be a very large challenge for data to be in the UK. It's quite a challenge. In other countries, it's also a challenge. So there are issues about ownership of data and privacy and keeping data personal, which are an issue, and they desperately need to be overcome so that we can address these questions using openly available data.